Hello world, my name is Dr. Kundlas and I've been a primary care physician for last 28 years. These days, we have been getting a lot of questions regarding blood pressure at doctor's office and home monitoring of the blood pressure. It is a very timely question, and in this video, I want to answer all of your questions about this hypertension crisis which we have. In the United States, about half of the population has high blood pressure, and about 30% of them, they even do not know they have hypertension. But just imagine you are at doctor's office and they tell you your blood pressure. Do you know just being in doctor's office, your blood pressure reading could be artificially high by about 30 millimeters of mercury? Yes, it sounds strange, but that could be the difference between you being started on antihypertensive medication versus lifestyle versus you don't have any problem. This is a real problem, and I face it and help people on daily basis. Home monitoring of blood pressure is the best way, A, to diagnose, and B, to monitor your blood pressure, and C, to check the response to the treatment. When you go to doctor's office, invariably you are a little anxious, a little bit of wait time, anxiety, and this whole structured environment leads to sympathetic overdrive that speeds up your heart, leads to constriction in your blood vessels. What we call is classic white coat syndrome. Your blood pressure goes up. And then I have monitored in my office and also other offices. The medical assistants do not use accurate and correct technique to check the blood pressure. Further, white coat syndrome affects about 30 to 40% of population. But we have the same percentage of people who feel secure, organized doctor's office, and structurally they feel relaxed and their blood pressure is completely normal. But once they check their blood pressure at home, it is high. That is exactly the opposite white coat syndrome, and it is next hypertension. What that means is the sense of security which structured environment inculcates into you leads to lowering of your blood pressure. Both white coat syndrome, mass hypertension are bad. In one condition, you will be overtreated, and in another condition, you will be undertreated. There was a study released by Kaiser Permanente, and they are one of the biggest organization which is vertically integrated. They are health insurance, they own doctor's office, they own whole healthcare delivery model. Home monitoring of blood pressure is a lot more superior in diagnosing hypertension, monitoring hypertension, and predicting cardiovascular risk factor and disease. We don't treat numbers, we treat the science or physiological changes behind these numbers. In order to prevent unnecessary medications, side effects, money, and false diagnosis, you must start monitoring your blood pressure. Then the question comes, if home monitoring blood pressure is so effective and so useful, what are the problems? The problem lies with faulty technique and faulty devices. If you do search, there are about 4,800 different kind of blood pressure machines which are sold on market. Only 400 of them are technically validated by independent organizations, which are professional grade. They are tested against old mercury blood pressure machine, and they are validated by those organizations. Your blood pressure reading will be trustworthy. There is a caveat. If you do Amazon research, most of the devices will say FDA cleared. FDA cleared only means they are not dangerous, they are not going to have burn, they are not going to blast on you. The chemical they are made up of is generally considered safe, but there is no check on the accuracy of data. It's like a tubing attached to a monitor and it spits out random numbers. There are two organizations which basically validate these devices, and getting a device validated by those organizations is not easy. It costs about 50 to 60,000 expense on behalf of these companies to get your device meet the standard and certify by them. It's FDA cleared. People buy it because it's a false sense of security. Further, to complicate the issue, Amazon rating 4-star, 5-star, they are just consumer reviews. They are not accuracy reviews. Very sad part was we do primarily value-based care where most of the Medicare Advantage patients have over-the-counter benefits. And I did on 6 health insurance supplemental paperwork which they provide our seniors to buy over the counter some medications of these devices. None of them was validated. They were both cheap, inaccurate devices. Even our insurance companies do not care to pay or at least have the validated devices on their list. What are these organizations? These organizations which validate these devices are, one is our national in the United States, which is AMA backed, and there is international ones which you could get your devices validated. Remember 2 websites which are very important. First one is validatebp. That is a organization which is backed up by American Medical Association, and they are known for rigorous testing. So when you are going to buy some blood pressure machine, look at the list. Go and visit the site validatebp.org and look whether that device is on the list. Second, internationally, there is a Stride, STRIDE, BP registry. You could access it online and check the device which you are going to buy is on their list. These 2 websites will provide you an accurate estimate. Once you buy the proper device, now your technique needs to come into play. Before you check your blood pressure, you must follow these 5 rules. First is no C rule. No caffeine, no cigarette, no talking. Preferably at least 30 minutes before your blood pressure check. Sit with your legs relaxed at 90 degrees, your back straight. Your cuff size needs to be accurate. Then your arm needs to be at heart level. All of these things, if you don't follow the no C rule, or your back is not straight, your legs are not at 90 degrees, or you are cross-legged and you're talking, your bladder is full, you could increase your blood pressure almost by 30 points. Same error like what happened in doctor's office, the white coat syndrome. You could, with faulty technique, can add 30-degree error. No matter which blood pressure machine you buy, they technically are about 5 millimeter off. So you have a built-in error, and when you add faulty technique, your reading could be off by almost 30. Then question comes in is which blood pressure machine to buy. I will divide them into 3 tiers. Validated machine is going to cost you, in my research, between $100 to $130 in the United States, and you could convert into equivalent one. Parameters it is automated, that it takes 3 serial readings automatically, one after the other, with 1 to 2 minutes interval. Then they provide you a consolidated blood pressure reading, which is an average of 3 readings. Number 2, how it connects, whether Bluetooth or through Wi-Fi. Both are acceptable because that takes away the load for you to manually write it and remember it. If these machines take this blood pressure and push it to the app, whether on Android or on iPhone or their proprietary app, we rarely leave our house without blood pressure machine. And when you go to your doctor's office, and if you have been checking it continuously on repeated intervals, you have a pattern on which your doctor can predictably act, and it can help. So the key parameters are automated. Number 2, how it connects. Number 3, it is taking serial readings and aggregating them. There are 2 brands in my research have come up repeatedly. Those are validated. They are on that validated BP list. One was Amaran Evolve, and the other one was Withering BPM Connect. This is not a sponsored video. Personally, for my monitoring, I use Withering BPM Connect, and I have been using that machine for last 3 years. And I do not have any problem with that. But what it does is when I go to my Prime PCP, I could show my readings, and that is very, very helpful. Then I want to bring in how much your errors individually can count towards your blood pressure. Let's take first no-see rule. If you're talking while taking your blood pressure, or you had a cigarette and coffee, that can falsely increase your blood pressure by 10 millimeters of mercury. If your legs are crossed, it can increase by another 10. If your back is not straight, 5 to 10. If you are taking your blood pressure, cuff size which is smaller than your arm, you could be adding inaccuracy by 30 millimeters of mercury. And if you are taking those, it could be another 10 to 15. And if your arm is not at heart level, that's another 10. So if you look at it, how many inaccuracies could be added? Then I get this question, what is my normal blood pressure? There are two standards which are being followed. One is the 8 guidelines, and the other is American Heart Association or American College of Cardiology guidelines. According to which most of the authorities believe it should be re-overhauled again. And most of the cardiologists don't even want to talk about that, and they consider they are obsolete. But according to JNC, they go with age. Anybody below the age of 60, your blood pressure must always be less than 190. And if you're above the age of 60, your blood pressure should always be less than 150 over 90. American College of Cardiology and American Heart Association, according to them, ideal blood pressure is less than 120 over 80. They consider it elevated a little bit if your blood pressure is between 121 to 129 systolic. And stage 1 hypertension is if your blood pressure is between 130 to 140 systolic and less than 90 diastolic. And stage 2 if it's more than 140 over 90. Yes, these numbers tend to confuse us, but as a rule of thumb, if you keep your blood pressure less than 140 systolic, less than 90 diastolic, you are in a safer range. And if you're checking at home and you take it to your physician, you could make it really help your physician by providing a pattern. Now we will enter a kind of a rapid fire. First question, why my home monitoring gives me different reading? Because you are alive, our blood pressure changes based on our activity level, our mental agony which we might be in, and it varies minute to minute, because that's how our body adjusts and take care of the things. What is the most accurate home BP monitor for 2026? I have searched all of them and I provided you with the criteria. Look at validatebp.org before you buy it. Amran, Evolve, and Withering BPM Connect, in my opinion, are the best, and they meet all the criteria, but they cost between $100 to $130 in US. Can I trust my home BP reading? Absolutely, you should trust these readings only if you have the right equipment and right end. So now let's put it together. What is your implementation checklist? First, select the right device. Go to validatebp.org and make sure the device which you're buying is on that list. Number, measure your arm size. Measure your arm and buy proper fitting size cuff. Absolutely do not buy any wrist machines because they are invariably inaccurate. I know it will cost you some money to buy a good machine, but it will save you thousands in preventing heart attack and stroke, or in terms of medication cost if you could prove that your blood pressure is normal. Then learn proper measurement techniques, follow no-see rule, sit straight, arms, legs 90 degree, no cross-legging, Make sure bladder is empty. When you check your blood pressure, your arm is at heart level and you are using cough. 1, to communicate with your doctor. The absolute number where you must act is if your blood pressure is more than 180 over 120. If you have one reading, don't panic because that will make your blood pressure go even higher. If you have blood pressure reading and you don't have any symptoms, meaning you don't have chest pain, you're not dizzy, you're not feeling weak, you don't have abdominal pain, you are not passing out, sit down calmly, close your eyes, wait 10 to 15 minutes. With the proper technique, take your blood pressure. If it is still high, it's time to call your doctor. If you develop any of those symptoms which I mentioned, it's time to go to the emergency room. Develop pattern of your blood pressure reading and take it to your doctor. You could save in thousands and you will live long and happy life. I hope in this video, I have made a case that home monitoring of blood pressure is the best way to diagnose hypertension, monitor hypertension, and also look at the response for the treatment. The best machine which you could afford, and it must be validated bp.org. Further, develop a pattern, take it to your doctor. I will see you in one of next videos. My channel, Kundlas MD, is dedicated to simplifying healthcare information. Like, share, and subscribe to our channel, and I will see you in next video. Thank you.